Hi everyone, Sarah, the owner of Nutrition and Whole Health Solutions in Stoneham. And we have just been really excited about our latest service that we have brought to the Boston area, which is SoftWave TRT, Tissue Regeneration Technologies. And I've had so many questions all about this new service and what it is. And I thought I would just bring on the expert, the man who's been helping me and our team bring this to the area, Dr. Dan McClimon from Pennsylvania. Dr. McClimon's been working with SoftWave since the beginning. We actually met at an international shockwave conference where we were hearing from, the surgeons out of Europe and South America who are using SoftWave and actually seeing that they're getting less surgeries, doing less surgeries, and doing more natural healing, which that's at the core of what we do. Dr. Dan is a dad, just like I'm a mom. Family and faith are at the cornerstone of what he does. And so we've really aligned with this. And so, Dr. Dan, thank you so much for taking the time with me today. I appreciate it.
Oh, it's my pleasure. I'm so excited, and I was able to come up there maybe a month or two ago and be with you guys in Stoneham. And it's just a great thing, great service to bring to the community. We're really excited for everything we've seen here outside of Philadelphia, and just to know that that's available now up where you guys are. I'm really excited about that.
Yeah. I mean, I don't know if I'm supposed to say it, but I'll say it anyways. But I mean, it is the major sports teams, Red Sox, Bruins, they have soft waves. So, I mean, we didn't want this to be something that was just for elite athletes because, in the Stoneham area, and I know I'm super active. You are too. I mean, one, running around with the kids, but two, I mean, going to the gym, I pick up heavy things and put them down. And I have a brother who has a gym and another brother who's a professional athlete and a sister who works in a dance studio. We're really an active community, and that's the type of people that we hang out with. But, it doesn't just have to be for elite athletes. It can also be, just for my client with mother's arm, the school janitor, people who have just long commutes and drives as we're all going back into the office and spending more time sitting at desks and computers. Why do you love SoftWave, Dr. Jan?
I think it's the approach of SoftWave is always least invasive, most conservative first. So, we want to address the root cause of these issues and tap into the body's ability to repair damaged tissue and regenerate new healthy tissue through stem cell migration, and do that naturally and non-invasively. And so, I find that that's what people are looking for. People tell me, I'm not a medication person. I don't want to do the injections. I certainly don't want to do the surgery or joint replacement, but I really don't know what else to do. I've been getting shots every 3 months or every 6 months, and say, hey, eventually we're going to wind up needing to replace this shoulder or hip or knee or whatever it is. Or maybe it's not gotten to that point, but people are losing sleep, they're in chronic pain, they're not able to walk as long as they used to, and they just want to be proactive and get out in front of this. So that's why I love it, because it gives us the ability to handle those things, and educate people on their body's ability to use their own stem cells and regenerate that damaged tissue.
Yeah, right. That's what it's about. We had a 75-year-old golfer the other day, and he's only been in for a couple treatments, and his full disclosure, his daughter dragged him in. Like, she's a friend of mine, and daughter dragged him in, and he didn't even know what he was coming in for, really. And but he's been compliant with it. He's so sweet, and looked at me and said, "Did I tell you the news, Sarah?" And I'm like, "What news?" And he's like, "I canceled my next cortisone injection." And like his face. It was so exciting to be able to see that. We have something laminated in our office. I think you might have even shared it with us. The 33 known side effects of cortisone injections.
Mhm.
Why
Yeah.
are we doing this to ourselves? And people, they do. I'm here. One of our staff members helps out with high school athletics, and she said she's seeing her high school girls already regularly getting cortisone injections. That's ridiculous, I think. So, as we have people come in, I mean, I know how I explain it, but you do it best. So, how does it work? How is SoftWave working in the body?
Yeah, so SoftWave therapy is a type of shockwave therapy, or in other words, it's an acoustic wave, so a sound wave. And that sound wave travels very fast through the tissue and it doesn't damage tissue. But what it does, there's a few things that happen immediately. Number one, when that sound wave goes through the tissue, it clears what they call senescent cells, which are dead cells and damaged tissue. It clears that out and it brings in blood flow and it helps to modulate inflammation. So that all happens immediately. And I can't tell you it's the number of people, it's way over 80% of people on their very first session, they feel looser, lighter, easier range of motion, less pain, like somebody put WD-40 in there. Boy, I haven't been able to move like this or get out of the chair or squat like this in, 20 years. That all happens immediately, which is amazing. But I tell people, look, nothing's fixed right at that first session, right at that first response. But what it does and why we do SoftWave therapy, and I work with providers all over the country and Canada, is because what happens in the weeks and the months following each SoftWave session is it causes resident stem cell migration. So your body's own resident stem cells, which stem cells can turn into any type of tissue, cartilage, disc, meniscus, ligament, tendon, peripheral nerve, blood vessel, can work to regenerate and repair new healthy tissues. So it activates local stem cells and it causes resident stem cell migration to the area of damaged tissue. And so it truly is a form of regenerative care. We're not just putting a Band-Aid on symptoms, we're tapping into the body's ability to repair damaged tissue and regenerate new healthy tissue. And most people just don't know about it yet, that that's actually a thing and they have access to it.
Right. Yeah. Yeah. We were just on a webinar recently about, true stem cell injections. And they were saying that this was the group that helped Mel Gibson's dad. And you have to fly to Panama. And I can only imagine what it costs. And it only lasts 20 months. It's unbelievable. And then you have to go do it again. So it's, what is the alternative? What are we looking at? And the technology is here. It's right here. When I was a little girl, right, I used to watch the Jetsons, and you'd think like, when is it going to be that robots can do all the things like Rosie on the Jetsons? And it's here. Like the future is here. And so stop just waiting for something to come, because this might be the sign that it's here. And we had a client the other day that drove 90 minutes, Dr. Dan. He had I don't even want to tell you, but I'll tell you anyways. He went from the boat to the dock and he fell in that space in between. And just his knee, cannot put any pressure on his knee. So I said to him, do something so I can see where the, limitation is. And can you do a squat or a lunge? It was the ugliest looking thing I've ever seen. It wasn't a squat. It wasn't a lunge. I mean, it was basically just like, he was like just dipping down. I mean, you could just see the pain. We did our first SoftWave mapping session. He went down into a squat, like, I mean, he dropped it like it was hot, like almost to the ground. It was unbelievable. His face when he came up, and he just was like, oh my gosh, like he was just sold. And so, of course, we don't, it's so sad when people have an acute injury. We've seen a couple of those. Even someone on the team rolled their ankle, and I was like, right to SoftWave. You're going right to SoftWave this week. And she's dancing tomorrow at her daughter's wedding, and she's going to do fine. So, but what are some of your favorite cases that you see in your office?
Well, you hit the nail on the head with there's really a couple categories. There's the acute injuries. We had a college baseball player who he was in his senior year. It was the first game of his senior year, and he did something when he swung to his wrist, and he couldn't even grip the bat. It was all swollen. They told him it was broken, and they're getting ready to go to Myrtle Beach for this long tournament over the week, and he can't play. And so I can relate to that. I was an athlete through school and had injuries and all that, and people told me I wouldn't be able to run anymore. And and so that's one of my favorites. We were able to work on his hand and wrist, and he was back playing within a week and a half, and he was able to go to Myrtle Beach and do the tournament and play his senior season. And so there's those acute injuries, even to the degree of, some doctors, they utilize it in the operating room to help the tissues heal faster. Achilles tendon surgeries, professional athletes, you'd know their names. I mean, they use the technology to help those tissues heal faster. But what we see an awful lot of are these sorts of things: knees, bone on bone degenerative knees, shoulders, rotator cuff, frozen shoulder, neck issues, carpal tunnel, that sort of thing. A lot of low back and hip issues and those SI joints there. That's a ton. Disc degeneration, ankles and feet, plantar fasciitis, and then a lot of wrist and hand arthritis in the hands, can't grip, all that kind of thing. There's others, but those are the most common. And I could tell you stories, but really it's all walks of life. There's stress, physical, chemical, and emotional stress in all of our lives to different degrees. And, some people cut hair for a living, other people work on a computer, other people they're climbing ladders and scaffold. They're driving in their car, their truck, they're holding the kids and down on the floor and up and down and everything. We have 4 little boys. So there's just a lot going on, and so I always tell people, symptoms or no symptoms, you want to get checked and see if there's damaged tissue, see if you can get help.
Yeah. I mean, but people are on the fence sometimes. They're like, what's it going to be like? Is it going to work for me? I think some people just don't want to love it for some reason. They just are, comfortable being miserable. And, but so what do you say to people? And when they hear about it in your office and they, don't know what they should do next, how do you get them to just try it? That's what I say. Just give it a try.
Yeah, it is amazing, and I get to work with doctors and neurologists and OBs, physical therapists, chiropractors all over the country and Canada. And I tell them, look, it really, quote unquote, sells itself. I mean, I don't have to convince people to do it. They want to know, what are my options? And, whenever something like those things I mentioned comes up in conversation, I tell them, look, we need to get you checked, or in other words, have a mapping session with the SoftWave unit, because the SoftWave unit, not only does it help clear the damaged tissue and regenerate new tissue with stem cells, but what it is also is a diagnostic tool. So when you do the SoftWave over healthy tissue, you don't feel it. But as soon as you have it over damaged tissue, you're going to feel it. It'll be a little tender. You'll feel that. And so that's called biofeedback. So I tell people, we don't guess, we test. I don't shoot from the hip. I don't know if I'm going to be able to help you, but if we can just get you in for a mapping session with the SoftWave, we're going to be able to tell within seconds, within minutes, is there damaged tissue? Where is it? How severe is it? And are you going to be a candidate for SoftWave therapy? And the great thing about that is way over 80% of people, not only do they get to figure that out, but they have significant benefit and relief just from the first session, which is always great. And I always tell people, look, have the camera going before and after, because, a lot of people are going to have a hard time believing it. They're not going to remember what it was like before, because we see so much change even after the one session.
Mm-hmm. Oh, I'm always so mad when we don't film it for
No.
their benefit, because, we tell people, to not keep it a secret. Don't keep it a secret. Tell your friends, tell your family, bring them in, because, we need to have them so they can have everyone benefit from it. And so, that's the biggest thing too. And those videos really do help. So we will send it to them so they can go right ahead and tell their, significant other. They can tell, their sister, their mother, their brother, their coworkers. And so we really want to help as many people as we can. I think I just want to tell people now, how do you book your first session with us in Stoneham is to go to our website, nwhslife.com. I'm sure wherever you're watching this, there'll be links and things that you can have. Call the office. Let us know. Let us know if it's just for you or if there's someone else you want to also get booked, because, it's growing in popularity. It's getting really busy. We can only imagine this fall. So we really want to, get you in as soon as we can and plan for that. So,
Yeah.
Dr. Jen, I really appreciate your time here today. You're the best.
Thank you so much. Really excited for you guys. Always here to help whatever I can do. And, get in. I tell people, look, it's not just about ourselves. This is a mission greater than ourselves. So there's people hoping and praying and searching for answers. They might be trying to avoid a knee replacement or just not being able to sleep. And it's important for us to tell them, hey, get in and get checked. And so whether somebody's in your household, like Sarah said, or maybe it's someone from church or from work, or a loved one, extended family member, even if they're not local, we can find a SoftWave provider for them in their area. But we just want to help as many people as we can, because most people just don't know that this is available.
That's so true. Yeah. Well, thanks for taking care of the Philadelphia area. I got Boston, and we'll make some more friends beyond to keep helping people. So I appreciate it, Dr. Dan. Talk soon.
That's great. Great to see you.